Guys, welcome back to the channel. So today I was doing some research and I ran across this article about hepatitis and how scientists gave over 1,000 vulnerable people hepatitis, and this was over 30 years ago. So when scientists gave 1,000 vulnerable people hepatitis over 30 years ago, what sort of system nurtures a decades long program of deliberately infecting children and prisoners with dangerous disease? There's a picture. So this was a ward at Willbrook State School in New York where some children were given hepatitis. In 1942, guys, in the grip of a Second World War, the U.S. military faced an existential threat from within. A hepatitis outbreak was suspected to have infected hundreds of thousands of personnel. There were no animal or cell structure models for studying the viral liver disease. Desperate to find the source of the outbreak and learn how to contain it, the military joined forces with the biomedical researchers, including some from the University of Pennsylvania in Philadelphia and Yale University in New Haven, Connecticut, to launch human experiments that continued for decades after the war. During the 30-year program, meticulously chronic in the dangerous medicine, researchers infected more than 1,000 people, including over 150 children, with the viruses that cause hepatitis. So they infected more than 1,000 people, including 150 children, with viruses that cause hepatitis. The people enrolled were prison inmates, disabled children, people with severe mental illness, and the conscientious objectors performing community service in lieu of fighting, relates historical sociologist Sidney Halpern, owing to the bias in the U.S. prison and psychiatric hospital populations. A disproportionate number were black. The long-term consequences will never fully be reckoned. Although rarely fatal in short term, hepatitis can lead to chronic liver disease and cancer after the initial infection. Excuse me. These days, horrifying stories of human medical experience in the mid-20th century are the well-trodden territory, the most famous being the studies in Tuskegee, Alabama, that withheld treatment from hundreds of black men with syphilis for decades, starting in the 1930s. Research abuse narratives are embedded in our collective memory. Halpern writes, they serve to affirm the moral priorities we proudly hold. But dangerous medicine does more than add to another gruesome narrative to the canon. It offers a thorough exploration of social, military, and scientific context that nurture what will be now considered repugnant and unethical medical conduct by avoiding a simple story of a single rogue investigator or team, and instead focus on the system that gave rise to abuse. Halpern amplifies the narrative that she painstakingly pieced together from hundreds of historical documents. Excuse me, guys. System failure. The hepatitis experiments began in 1942. So the syphilis, Tuskegee of Alabama, the Tuskegee experiment was in the 1930s, started in the 1930s, guys. So 12 years later, the hepatitis experiment began in 1942 with the outbreak of disease among U.S. soldiers and military personnel, which was researchers eventually determined caused by a contaminated batch of yellow fever vaccines. Look at that. Launched under the aegis of the war effort, the studies ended only in 1972. Guys, 30 years later, when the public and professional sentiment towards experiments on vulnerable populations shift. Let me tell you who vulnerable populations are. Black and Latino Hispanic people, the poor, the unwealthy, the poverty people. Those are the vulnerable populations. Researchers studied a wide range of hepatitis biology, distinguishing between hepatitis A, which transmitted by contaminated food, and hepatitis B, often spread by contaminated blood products. They looked for ways to inactivate the hepatitis B virus in blood supplies and tested treatments in the mean of prevention. Some of these studies involve deliberately exposing people to infected material either by injecting or through ingestion of milkshakes containing hepatitis virus in the form of stool samples mixed with chocolate milk. Shame on y'all. That's disgusting. Disgusting, very disgusting. At least 4 people died from the disease in the course of these experiments, but with no long-term follow-up monitoring stopped when the individual experiments ended. There are no data on how many became disabled or died years later as a result of the infection. Hepatitis started because of a contaminated batch of yellow fever. Then they was doing experiments. The experiments ended in 1972, but they was doing these experiments on vulnerable populations, Black, Hispanic, Latino people. Then they was putting these hepatitis in people's food in a milkshake containing the hepatitis virus in the form of a stool sample mixed with chocolate milk. I'm not surprised, guys. For decades, the researchers justified their work to colleagues in press, reframing it to meet the ethos of the times. Initially, it was portrayed as necessary sacrifice to support the troops. Later, experiments on people in prison were pitched as path to rehabilitation through service to society. Studies on mentally ill people were extensive of fever therapy. The idea among some scientists at the time that high body temperature caused by infectious disease such as malaria and perhaps hepatitis might improve some psychiatric conditions. Come on now. And experiments on disabled children were rationalized as an attempt to generate immunity against a disease that was already frequent and crowded in unhygienic institutions in which they were housed. Notwithstanding her attention to context, Halpern does not let individuals off the hook. Some study leaders knew how their work might horrify the public and tried to control how they were portrayed in the press, first suppressing coverage and later encouraging narratives that painted participants as heroes. Some journals' editors not only published scientific findings from hepatitis experiments, but also wrote editorial praising the work. I am lost for words, but I am learning. And Halpern points out, although the long-term consequences of hepatitis were not fully understood at the time of these experiments, they were signs as early as 1940s, and the researchers could have acknowledged them. Eventually, by the 1970s and 80s, epidemiology studies had shown that carriers of hepatitis B were more likely to develop cirrhosis and liver cancer than those who were not carriers. Particularly crushing is the naivety about how hepatitis affects children. The immediate symptoms are not as severe in children, so scientists argue that infecting young people would give them immunity that would protect them when they grew older and more vulnerable to severe infections. In fact, children hepatitis B are much more likely than affected adults to become lifelong carriers and to experience long-term consequences. There was a time when we could have casually looked down our noses at mid-20th century ignorance about infectious diseases. But with the world still in throes of coronavirus pandemic, I was struck by parallels. Witness how efforts have been focused on the acute impact of disease, hospitalization, death, without much thought to long-term consequences. Or think how those with the least agency, children and people in prison, people with severe mental illness, have been put at risk by those with the most power. Formerly, our approach to medical ethics has improved since the 1940s. Your approach? But how parent reminds us that many clinical trials in healthy individuals still rely on vulnerable populations. Some people move from one to the next in search of food, housing, or remuneration in exchange for the participant. People in regions with poor access to healthcare sometimes have to enroll to get basic medical treatment. And in the United States, there is no requirement to provide compensation for long-term disabilities that might arise from participation in clinical trials. Halpern has created a haunting narrative that forces the readers to confront our modern social and scientific frame of reference. Long after this book is finished, the question remains: what research abuses are we justifying ourselves today? Guys, when I say this, I'm going to say it with all my heart. You cannot trust doctors, psychiatrists, sociologists. People cannot be trusted just because they went to school 12 years and they graduated and they still study these same practices as these past people in the 1800s, 17, 1600s. This has been going on for years, and I am glad that people are shining a light. I am glad that I ran across this article because I would love to inform people about what has went on and what is still going on. A lot of people are still poor and they're being experimented on. Trust yourself. Trust the Most High. Trust the Elohim. By His stripes, you can be healed. These people use humans as experiments to launch human experiments that continue for decades after the war. This is a 30-year program that infected more than 1,000 people, including over 150 children with viruses that cause hepatitis. The people enrolled were prison inmates, disabled children, people with severe mental illness, and the conscientious objective performing community service and lean of fighting owing to the bias in the U.S. prison and psychiatric hospital populations. A disproportionate number were black. Then they talk about the Tuskegee experiment, where they withheld treatment from hundreds of black men with syphilis for decades, starting in the 1930s. The hepatitis experiment began in 1940 with the outbreak of the disease among U.S. soldiers. This disease outbreak didn't start with mentally ill people, black people, vulnerable populations, Latinos, Hispanic, poor white people, kids, disabled kids, prison inmates. This started amongst U.S. soldiers and military personnel, and they decided to take their experiments out into vulnerable population to where they can experiment on these people without them knowing, no knowledge, which was researchers eventually determined caused by contaminated batch of yellow fever vaccine. Come on, y'all. And this started in 1942 and it ended supposedly in 1972. My mother was born in 1975. You cannot trust the system. Trust the Elohim. Prayer. I'm out, y'all.